When do new patients start to make a decision about accepting your recommendations?
Welcome to AMC. I'm Dr. Greg Miller. We're in a series on office evaluation, and today we're going to cover the topic office layout with Dr. Jeremy Brubaker. Let's go ahead and get started.
When do new patients start to make a decision about accepting your recommendations? Think about that. When does that start? Well, it starts, number one, back at the first encounter, right? If it's a phone call to the office, they start to make a decision, right? If it's a website, they land on a website or a landing page or see an ad, they're starting to make a decision. But what I wanted to focus on today, and in this series, we're talking about our office evaluation. I want to talk about our office and the layout. And I wanted to start, where does a patient start to make a decision when it comes to the physical location? Believe it or not, it's as they pull into your parking lot. What their innate tells them, what they perceive is their reality. So if I pull into your parking lot and I see weeds, I see a neglected parking lot with potholes and my car is bouncing up and down as I'm just pulling in, paint is peeling off the wall or the door handle jiggles and is loose, it tells me something. Whether it's true or not, doesn't matter. It's what my perception is now my reality going, this is a neglected place, this is a sloppy office, they don't really pay attention to details, and all that before they even walk through the front door. So just want you to get to think about that, and we do that in our offices every 6 months or sooner. We all put our new patient glasses on and we walk from the parking lot throughout the office. What does a new patient see? And more importantly, what do they feel and what does it tell their innate about us before me as the doctor ever gets a chance to sit in that consultation room and find out how we can help them. So keep that in mind from an office evaluation standpoint. And again, we can talk about that on a later video about how every room in the office, when they walk into it, they should know what's going to happen in there, right? If they walk into my consult room, they know I'm educated, I'm well qualified, I'm a professional, I'm ready to take on their case. They know that just from the feel of that physical room. So again, a lot of details we could go into there, but just keep that in mind. What we're going to talk about is the efficiency of the layout of an office. Now, some of you watching this have been in practice for years and years and years, so it'll sound familiar. Some of you maybe are newer and not in practice yet, and I'll give you some good food for thought as you're arranging just the physical location of, where does the therapy room relate to the front desk or the x-ray exam area related to the consult room. So we want to think of this, and the best way I can describe this to you is in an office layout standpoint, we're going to create different zones. Meaning, if I've got front desk staff, I want to create a zone that they can stay in, right? If you think of it like a triangle, right? They're at the front desk, they may bounce over to a therapy area. They're obviously managing the reception area where patients are coming in and seated, and they're going to manage their zone without getting out of that zone too often. You follow me? So same token with the doctor. The doctor's going to have a zone in that office from a physical standpoint where it's going to be consult, exam, x-ray if you have that in there, and then treatment area, right? They're going to kind of migrate and stay in their zone. And if you find yourself in practice where you're at the front desk a bunch, you're out of your zone. You're losing what we call efficiency. And any layout or any office flow, and if we want it as productive as possible, it's going to come down to the efficiency of that layout. So the different zones are going to be key to your success, and how far you're going to go before you start to find or see those efficiency breakdowns, which obviously is going to lead to some proficiency, productivity, and decreased profitability, or the potential of profitability. So is it important? It's important. I'll give you one example, and this one always stands out to me. One of our offices, we went there and we're examining just what it looked like, what it felt, what the staff was up to, and found out very quickly a front desk staff was getting out of her zone 50, 60, 70 times a day, meaning she was taking patients from the front and physically walking them back to the treatment area, getting them set up and whatever was entailed with that, and then back. So up and back and up and back. Now, for the doctor in his room, not paying much attention, he's just going room to room, and the patients are there. They're set up the way he wants them to, which is fine. But that poor front desk gal was wearing herself out 60, 70 times a day up and down the hall. Not the most efficient way to stay in your zone. Quick fix was you put a chair outside the room like a jump seat, send the patient back, let them feed themselves. That was the solution in that office. And I kid you not, within 60 days, that office jumped about $10,000 a month because that staff was able to stay in their zone. We became more efficient, which led to the capacity to see more patients and treat them at a higher level. So just that office flow is key. So when if you're designing an office, some of you already have that in place, we want to think about, as a patient walks through the door, where do they check in? All right? Is that efficient? Yes. When they're sent back to a treatment, and whether they go to therapy first or they go back to see the doctor first, or however that works in your space, but where do they go? Is it effective and efficient, number one, for the staff and for the patients? Can they get where they need to be in an efficient manner? So the doctor, and who has ever experienced this, sitting there waiting for patients to be either loaded or come to you, that's a breakdown in efficiency. So we want to make sure they get from the front to where they need to be, whether in a jump seat or straight into a treatment room. They get there efficiently, effectively as possible, and not necessarily having to walk 2,400 square feet back to the corner of the office. So the position of these rooms in relationship to the zones needs to be considered. And if you can make some changes in your office, if you find as a doctor you've got to walk the whole way across the office space to do a consultation, then you've got to walk the whole way across to do a treatment, then you just start to count your steps in the office. At a lower volume, it doesn't seem that important, but as we serve and treat more patients on a daily basis, every step makes a difference. It really does. And I'll break this down for doctors that don't think that. If we're seeing 40 or 50 patients a day and we're taking 10, 15, 20, 30 steps in between each one of those patients, well, do the math. How many minutes a day do you spend just walking in between if you could shorten that? And normally we can carve out hours a week of just inefficient, movement throughout the office. Number one, for the staff. Number two, for the doctors. So if you ever go home from a day and you're just dog tired, it was a busy day, but you're just physically exhausted, you want to come back and look at this office layout going, what could we do better? Could we put a door in between treatment rooms where the doctor doesn't have to come out and around and bounce from multiple? He could just go in between rooms. Maybe a solution. Obviously, from a staff standpoint, being able to send patients where they need to be without physically walking in there is a solution. So I just wanted to share with you some of these basic fundamentals of an office layout and some concepts of how to arrange that. We will get into more detail, hopefully, in a later episode, but hopefully that's helpful for you to get you started and thinking differently, not only what the patient sees, what they feel, what their perception is about your office, but also how we are effectively managing our efficiency, both for the patient's sake, of course, for our staff, and the doctor's energy levels throughout the day.
Hey guys, I'm Dr. Wade Verch. I practice in Newberry, South Carolina. I've been with AMC for 5 or 6 years. I was a Right starter, which is really an unfair advantage if you're a student looking to branch out and have a really successful start. Strongly recommend getting in touch with these guys. They know what they're doing. The biggest thing that's changed for me over the last couple of years is I've really looked at my office, as a business. Businesses need to be fed. Businesses need to be efficient. And that's what's going to take you to that next level, which is extremely important if you want to continue to grow, help more people, and secure, a very comfortable living for yourself, because nobody wants to go into practice and be hungry or worried about next month or worried about being broke. So look at your office. How can this work better? Office layout is going to be the difference between efficiency and inefficiency, and efficiency leads to profitability. So if you take a look at the flow of how your office is going to move, steps count.
Thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about AMC and how it might help your practice, you can always reach out to us at amcfamily.com.